All right, good afternoon, everyone. Thank you so much for joining us today. Uh, today uh, we are going over the webinar using social media as a community engagement tool for HIV prevention efforts. My name is Christina Santana. I am on our prevention team here at NASTAD, and we work to provide TA, particularly on the prevention team for the EHE uh, efforts. So we are welcomed by our friend and partner at KFF, Robin Kistler. Today, we will be going over, Robin will reiterate this, but this webinar is really not meant to be a 101 to social media, but more so looking at the role of social media or what role it could potentially be within community engagement efforts as one tool within community engagement toolbox. So next slide, please. So again, welcome and agenda. This is our overview. Then we'll go through about NASAD, and then Robin will share about KFF, I believe later in the presentation, unless I had that wrong. And we'll kick off the webinar looking at what meaningful community engagement is. So to set the scene, we won't be going in depth into all of the bits and pieces of community engagement. We will kind of be touching on pieces relevant to this topic. However, we will leave you with some resources that can help you explore more of community engagement. Then I'll turn it over to Robin at KFF, and she'll go into why use social media, and then what existing social media resources are currently being utilized or can be utilized via the Greater Than campaign. And then we'll close it up with some Q&A. Before we jump in, I want to share that, as you see on the screen, funding for this webinar was made possible by CDC's PS 19-1906 Component A, Strategic Partnerships and Planning to Support Ending the HIV Epidemic in the U.S. The views expressed in written materials or in publications and by the speakers or moderators do not necessarily reflect the official views and policies of the CDC, nor does mention of trade names, commercial practices, or organizations imply endorsement by the US government. Next slide. So for those not familiar with NASTAD, we are a national nonprofit organization, public health organization that works and represents public health officials who specifically administer HIV and hepatitis programs. We work with all 50 US states, and we also work with the District of Columbia, Puerto Rico, the US Virgin Islands, 7 local jurisdictions receiving direct funding from the CDC, as well as the US Pacific Islands. And we do that through prevention and care efforts, both across HIV and hepatitis, drug user health, policy work, and health equity work. Next slide. Here's our mission and vision. Really is to end the intersecting epidemics of HIV, viral hepatitis, and related conditions by strengthening domestic governmental public health through advocacy, capacity building, and social justice. Next slide. Okay, so again, the purpose of this webinar is to explore community engagement principles and really demonstrate how social media can effectively promote messaging and fostering connections with diverse communities. So we're looking to highlight a brief introduction and understanding of community engagement principles and kind of setting the scene for leveraging social media via effective outreach. And then also exploring, again, the existing resources to enhance HIV prevention efforts. Next slide. Okay. So what is meaningful engagement? Next slide, please. So first, I think it's important to kind of set the scene on language. Often within community engagement, we might use population and community interchangeably, but they actually do have significant meaning in how they're used or what they can signify for individuals in this work. So often when we use population, we use it as an external identifier. So, kind of removing or separating ourselves from a group of people that we then group into a population. It can have a more exclusive or siloed perspective, again, because it's removing self from it. Um, and it can be viewed as uncoordinated, meaning that, like communication between um, the two parties, so yourself and the external population you're identifying, may not be um, established or effective. It can also mean that, um, you know, uh, just connection in general or understanding of that group may not be established. Whereas with community, it's more of a self-identifier, something that we typically include folks in the conversation. So we're not talking about a particular group. We are talking in or with a particular group. So it has an inclusive perspective and can often symbolize be a symbol more of unity or a united understanding and united experience, things like that. Next slide. So a simple definition that we use that we found from the CDC is that community engagement is defined as the process of working collaboratively with and through groups of people affiliated by geographic proximity, special interest, or similar situations to address issues affecting the well-being of those people. The way I like to break it down, if you're going to think about community engagement, in I'd like to think about it in three things. It's ongoing, meaning that it's a never-ending process. It's cumulative, meaning it builds upon itself. So thinking back, if it's ongoing, we are constantly learning. We are constantly building mutual understanding. And then the last piece, it is trust building. So it's really founded in trust between groups of people or institutions and people, and really looking at what that relationship around trust how it can exist within whatever network or 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 population. Next slide. So why do we use community engagement? This shouldn't come as a surprise to anyone. However, I think it's just good to put this into perspective. So one of the ways that in which we use community engagement is to address a community need or a need in the community, right? So this can be looked at two ways. So thinking about the way I phrased it. Address a community need could be something that's identified by the community that has been brought to the attention of the organization or agency that is looking to incorporate community engagement. Or just a need in the community could be something that the agency or corporation has identified as a potential need for the community. So both can be valid. It's just also really important to make space for both and understand how you're approaching that engagement, if it's from an identified community need or a community need that's been brought to the attention of your respective organization. The next is to improve people's health. We know that one of the best ways to that we see people empowered to seek better health engagement is through connection, through mutual understanding, through education, and community engagement allows for that to happen. So we're able to touch individuals and build their understanding, their knowledge, which we know has a direct impact into their self-efficacy to improve their own health. Next, it's to empower those who lack power to gain some control over their health. And I want to be careful with the phrasing of this. So again, empowerment of individuals cannot come externally. It has to come internally from individuals or within a community. So it's not that we are giving them the power, so to speak, to make changes, is that we are providing resources, support, and access to things that help them feel more in control and autonomous in their own health journey. Next is to, again, build relationships and build trust. This is a constant theme in community engagement that's really key to whether or not the information you're sharing is receptive, whether or not the programs you're developing are successful, depending on how you define that. And whether or not the work you're doing can be sustainable. And then the last piece is to connect people to services or programming. So again, they all work together, they all build off of each other. You improve people's health by connecting them to services and programming. The types of services and programming you connect or you develop reinforces the relationship and the trust building. So ideally, they all work on some level of synergy. Next slide. Here are some community engagement principles that I found via the Kerwin Institute at The Ohio State University. And these are really just simple principles that I think we may all be aware of, and that may seem intuitive or natural. Just I think again, it's important to call attention and call out and say, these are fundamental in community engagement. So when we're looking at community engagement principles, it's really about setting clear goals, developing cultural humility, so going beyond competence and recognizing that, again, it's a mutualistic relationship. So not only are you learning about other individuals, but you're also, they're welcoming you into their space, you're welcoming them into your space, and you're building a mutual understanding about culture and the influence that may have and how they show up, how they interact, things like that. Again, related to that is representation. There's plenty of research that shows how impactful representation can be to individuals as they seek services, as they seek connection. Ensuring that depending on the program or the services you're providing, having a good understanding of the impact and how to properly represent those who you're seeking to engage or wanting to connect with. Again, build partnership and trust, right? I think I've said enough of that. The next is learn about community, and it's not from this, not from the perspective of like research or, you know, a siloed approach, but investing in learning about the community. So it could be, knowing the cultural moments that are impactful, going to their festivals, going to community organizations that highlight the cultural or community aspects of whatever community you're looking to engage. Foster transparency. NASAD has a community engagement toolkit, and one of the things that we really try to highlight in this toolkit is to foster transparency, and that includes being honest and open about limitations. So transparency looks different for every individual, for every community, for every agency and organization. And it's really about having open, honest conversations about what transparency could or should look like with your community, between you and your community, and what limitations may exist. One of the easier examples of limitations are if there are some policies or laws in place that limit your ability to be transparent on certain information. But again, transparency really connects back to that building trust. The next is to provide and promote capacity building. So we are all in a position where we're able to uplift and provide capacity building or training or skill building to our community members. So that is a great way to build community engagement connection. And then lastly, as I said, maintain long-term commitment. Next slide. So these are the different community models that can exist. And really it's just about categorization, if you will. So the ways in which we may show up in different spaces within a community. So from a systems perspective, these may be the larger pieces in which we function and navigate on a day-to-day basis. So thinking about our jobs, schools, local government, and then the shared responsibility that may exist regarding community well-being. Next, we have the social perspective. And this is more of the personal connections that we may have, not intimate, but it could be friendship circles. It could be things like your bowling league, or a group that you're involved with, or hobbies or things like that. Or it could be friends that you've made within a work social or work circle. So it's thinking about the social networks that you're building. Next is the individual perspective, and these are the more intimate, closer relationships that help us create community. So thinking about family, friends, folks that you may be more open with, that is, your individual perspective. And then the fourth one, which I feel is really relevant to this conversation, is a virtual perspective. So thinking about how our system, social and individual, can play a role within a virtual setting. So thinking about being online or through some technology, how we may show up in those spaces and build community. Next. Here in front of you, I know it might be hard to see, but we will be sending the slides out. This is the community engagement spectrum. So this just looks at the increasing level of community involvement, and where you may fall in the work that you're doing. So I would encourage you not to look at it from a tiered perspective. Um, Although, as we move from outreach to shared leadership, there are benefits to opening up to a collaborative or shared leadership perspective in terms of the spectrum. So outreach is the least involved of what community may be, but that could also be like, it may be necessary in the type of activity that you're doing. Whereas collaborative and shared leadership is direct involvement of community in the work that you're doing. So I encourage you to take a look at this a little bit more and explore maybe where your programming or your community engagement services fall, and if it fits, or maybe if there's opportunities to move past where it is, more towards a collaborative shared leadership. Next slide. So the last slide I have is really, how does this all relate to social media? So as I was saying with the community models, the virtual space, and in particular for this webinar, social media is a way that we have grown to engage with folks, to learn about what's happening in people's lives, to learn about news. It's, the way that most people receive their information, their news nowadays. So it can be a tool to help connect with individuals within your respective agencies and organizations. There are nuances to it, and it can face some challenges. However, what we really wanted to highlight with this webinar is looking at what is already existing, so that the undertaking of using social media isn't as heavy, if you are starting out, or even if you have established social media, but you're looking for other opportunities to streamline your process. So I will stop there and I will turn it over to Robin from KFF.
Thank you, Christina. And hi, everyone. Social media at its best is exactly how you describe community engagement: the ongoing, cumulative, and trust building. And then those 8 principles that you shared, I can see pieces of messaging and approaches through all of those. So this is going to be a great continuation of the session. My name's Robin Kistler, and I'm a senior consultant on the social impact media team at KFF. For the past 18 years, I've helped, I'm not that old. For the past 18 years, maybe older than I look, I've helped communities engage with our resources to advance goals to end the HIV epidemic, which I am passionate about for many reasons, starting with including my grandfather's diagnosis in 1986. And just this morning, I heard from someone who works in a hospital in the South who's close to me. They've had a patient who's a woman in her early 30s who got an AIDS diagnosis in July, and she's been hospitalized for a month and a half. So as you all know well, HIV is still with us and can and does affect everyone. So I'm really glad to have the opportunity to talk about some ways that social media can play in community engagement as one piece of helping to end the HIV epidemic, along with all of the other tools and programs that you all are creating. Our team at KFF has decades of experience using social media and other digital platforms to reach communities. So I hope you'll find some tools and ideas in the next half hour while I talk about some approaches we've learned through the years that you may be able to use for your own programming. And I'm going to talk fast, cram a lot in. I will try not to talk too fast, but if you have questions, just chat in the, add a question in the chat. We'll try to get to them at the end. If it's burning, feel free to go ahead and pop in there, and we'll try to get to that. So I'm going to share, as Christina said, some specific messages and examples of ways health departments and community organizations are using greater than HIV resources on their social media, including with syndemic and whole person health approaches. So I invite you to jot down ideas for yourself and make sure you come away from this time with at least one concrete next step, something that you want to do differently or start a conversation, an action step. So if you'd like to share those at the end, we will invite you to do that. So next slide, about us. The Social Impact Media Team is part of KFF. We're a national nonprofit organization that provides information about health issues in the United States. And as part of our Greater Than initiative, our team produces social marketing resources on HIV and STDs for health departments and community organizations to use. So please keep in mind, everything that I share with you today and everything that KFF produces is free for you to use in your social media posts, marketing efforts, trainings, any other way that you can see to use it. So everything of ours is yours. Our brand and our slogan, "Together we are greater than," is intended to be uplifting and empowering, as well as a call to action for individuals and communities affected by HIV and all the other intersecting issues. It is also literal. Greater than is you and me and everyone we bring with us to address sexual health and equitable access to information and services in our communities together. Our messaging approaches HIV prevention and treatment, testing, myths, stigma, and all the other, as many of the other things as we can get to. There are so many intersections. And really, ultimately, what we're trying to do is give people information access and direct them to your services. So sometimes you can see examples here. We have the opportunity to partner with local agencies to help place radio or billboards or TV ads, traditional media. I think I saw one of our partners from South Carolina here. Hey, Felicia. And other formats here. But our specialty really is in using digital marketing, social media, and other formats to reach specific communities and specific individuals within our communities. Since 2009, when the iPhone first came out, and even before that with websites, we've been developing messaging for digital spaces because that's where most of our eyes are spending our time now. So here's a question for you. This is audience participation time. I'm not going to run a poll, but just think to yourself, which social media platform do you think is used by the highest percentage of adults in America? Where are adults in America? What platform are they going to? What social media comes to mind? So you can answer that for yourself. Tell your colleague if you're sitting with somebody else. What's the most used social media platform in America in terms of percent of people who use it? Did you guess it was YouTube? I'm guessing most of you did not. And I'm also betting that most of your agencies don't have YouTube channels. But according to Pew Charitable Trust survey a year ago, 83% of American adults use YouTube. If you look at teens, that number goes up to 95%. So almost all of our teens are using YouTube. That's a key group that we want to be in conversation with, right? And you can see her Facebook and Instagram if you don't know all the logos. So the next two, if you're not on your phone all the time, like the rest of America, Facebook and Instagram, both owned by the Meta is the name of the company that owns them, are the next two. So that's why we're having this session today, the why social media. Our communities are, especially some populations of focus, are on devices, on these apps specifically, a lot. So I think that's why NASDAQ asked us to present today and to underscore that social media are really important opportunities for community engagement. And we know there are tons of barriers, particularly for health departments, to leverage them. So I'm going to try to share some lower hanging fruit ways to sort of jump in. And I'd be happy to talk to any of you, and follow up. That's fine to go on to the next slide. We are posting, so one easy thing is we are posting new content to our channels pretty frequently, multiple times a week. And we, of course, get lots of views on our YouTube and Meta and other platforms. Just organically is when you're putting it up, and whoever sees it, whatever the algorithm of the day is. It's not a huge number of people, right? But that frequency, the trust building, the ongoing piece is important. So my first tip is a super easy way to expand your own social media presence is just sharing what we post on Facebook once or twice a week. I know it takes so much time and effort to choose images and write posts and get them approved. We know because we do it ourselves. So take a shortcut and leverage or adapt what we were already putting out there. On the other hand, that's sort of organic free stuff, low-hanging fruit. If you have any size of budget to do paid marketing on YouTube or any of the other digital channels, so you can reach people in your own community, or even a small budget to boost your social media posts. Let's say you have $100 to put behind your Facebook and Instagram. You put all this time and effort to figure out what's going to get up there. And honestly, not that many people see, out of your total followers, a small percent will see any post on any given day. But you can direct the platform specifically in terms of who you want it to reach if you put some budget behind it. So that's this graphic. You can tell it to focus on your jurisdiction, specific geography within your jurisdiction, even down to a zip code level, and then also language, gender, age. Like, think of how demographics can help shape where your message is being seen and who is seeing it. And even affinities like for LGBTQ folks or specific racial and ethnicity groups. So another reason to use social media for community engagement is that you can prioritize who in the community you want to reach and really do it at scale if you have some resources to put behind it. Our messages hit all of the pillars of EHE: diagnose, treat, prevent, and respond. I'm going to show you some specific examples for each, as well as some intersections. So let's jump in and start with diagnose. We operate the largest national HIV testing day activation in the country. And I believe most of your jurisdictions are already a part of it. If you are not yet, we welcome you to join us for 2025. And I'll put a link in the chat where you can do that. We coordinate with many of you to identify and confirm local testing partners who offer free HIV, and this year also syphilis and hepatitis C testing at select Walgreens locations across the country. So I'm sure you can tell from these beautiful photos that this is all about community engagement. As this map and the numbers show, we're with local partners in over 500 locations around the country, including 95% of the EHE jurisdictions that participated this year and lots of other places too. So you can see here examples of how some of those partners use their own social media posts to get more visibility in their communities. We saw Cobb Douglas, Arkansas, we've got different counties here. These are easy posts. And if you're not doing, the National HIV Testing Day event, really this is a model of what other outreach are you doing and how can you add social media into that? Show you're out in the community, feature your staff and thank them. I would just caution against including clients in your posts. I think maybe that's, there's privacy stuff, but post what you're doing to engage the community. It's a good look, particularly, to sort of raise the visibility of the organization and helps to amplify what you're already doing, where you're already putting time and resources. I know there can be limitations for some jurisdictions on these sorts of posts. One strategy I've seen folks use, it just might not be, if you're a state health department, it may be that the state's accounts are not going to make HIV top of mind every day, right? They've got a lot of other issues and you got to fight for any kind of space on there, if at all. Some jurisdictions have created specific HIV social media accounts or disease prevention accounts that can kind of build an audience and have more control and frequency over the messages that all of us work on. And it can also build a more focused audience of folks who want to see that kind of content. And I know you might be thinking, and we've done that, we barely have any followers. And that's where, again, I'd suggest if you just have a little bit of resources and can figure out the logistics of boosting your posts, whether or not you have a big following, you can reach more members of your community beyond your own followers, or at least make sure the algorithm sees your own posts, shows it to your own followers, that even if that's not feasible for your agency, then maybe work with some contracted partners to ensure information is where our audiences are in your communities and jurisdictions. So there's a couple of different strategies there. So let's take a quick look at some more fun ways that your peers have used social media accounts to get the word out. This is specifically around the National HIV Testing Day, but look at the variety. There's groups being featured, individuals, music, there's playful, serious. Let's just take a peek.
Do me a favor, can y'all share this video today? Because today is National HIV Testing Day.
Happy National HIV Testing Day for Care Community Health.
We're doing testing for Hep C and HIV. Tests take about 15 to 20 minutes, so come see us out here.
Happy National HIV Testing Day.
HIV Testing Day. We're offering free HIV tests.
Giving resources to the community right here with us helping us incorporate it.
You can go to greaterthan.org, put in your zip code, and you will be able to find out which Walgreens location you can go to.
National HIV Testing Day is in Oak Park, Maryland.
Awesome. I just put the link in the chat. We can go on. I just put the link in the chat if you're interested in joining us for 2025, whether testing on the ground or helping to amplify with your own social media, we absolutely welcome you. So quickly on diagnose, we could spend a whole hour just on testing messages. Let's talk about some of our messages related to treating for HIV, explaining the benefits of an undetectable viral load, U equals U, and how to get there. These are all screenshots of videos and graphics you can use for free in your social media posts, just giving you a sense of the mix of real people who explain in their own words in English and Spanish. Let's just watch a full video as an example of one of them to give you an idea.
I had not heard about HIV as much as I would have wanted to. I knew that there was some type of treatment, but I didn't know how it worked. I'm not cured. HIV is still in my body, but with medication taken daily, I can reduce it to a very low amount. Undetectable means that the virus is no longer harming my immune system, and it also means that I can't transmit it to anyone else.
Some ways this is optimized for social media are its size, designed for stories and reels, that vertical presentation on Facebook or Instagram or TikTok. It has the keywords and big, easy to read text. So if someone doesn't have the volume up, imagine someone's, on a bus or sitting on the couch and somebody's near them. They don't want them to know that they're listening to an HIV message. They can still get all of the content. And it's also super short, right? Folks are scrolling. We just have a few seconds to communicate on these platforms. So let's now take a look, in addition to explaining undetectable and the benefits of treatment, and that's super important. We also know people need to know where and how to get into HIV care. ARVs aren't just for folks with Magic Johnson, so with Magic Johnson kind of money. So we have these messages about the Ryan White program, what it is, what's covered, and these can be linked to a specific clinic or a directory of services. We often link to the HIV.gov locator if we're promoting nationally, but you can link specifically to your own service organization or to your own local directory or into the national directory, and folks can use their zip code to find what's near them. So these, I'm just showing you clips. These are screenshots from a bunch of the different folks and voices who are in the messages, that idea of building trust and showing community, being connected, transparent. Let's just take a look at an example of one of the Ryan White.
I always think about my first day of being diagnosed. How would we be able to pay for the medications? The Ryan White program basically saved my life. It has afforded me my medication, co-pays and assistance, my labs to keep me healthy. If you're living with HIV, with insurance or without insurance, it assists to offset your dental, food, transportation, medication assistance, and much more.
So I'll show you in a minute some examples of organizations that have been using these and how they get localized when you post them on social media. But let's just connect to the next pillar. I told you we'd go through all four. This is moving on to prevent. Of course, diagnosing and treating contribute to prevention, but we also have PrEP and PEP and other tools, and just a mix of messages, particularly on PrEP, where depending where someone may be in their journey, if they're just learning that PrEP exists, or we may be helping to normalize PrEP as an option that real people choose, and emphasizing how it makes them feel protected, liberated, as Monica is saying in this message here. So let's take a peek at one of those.
The first time I heard about PrEP, I didn't know what it was. But then once I actually started doing my own research about it, I'm like, wow, okay, why not PrEP? It's like I know I don't have to worry about HIV.
You could put that on your own profile with your own PrEP clinic information, or the where to go on your website to get more PrEP information, right? Like all of that's available to kind of zhuzh up your posts, and it's free. I do want to show one more video. We did those three pillars, and I'll get to respond in a moment too. But in the pillars, sometimes we miss some of the roots that keep us from ending the HIV epidemic that I know you all are very familiar with. Stigma is the first thing that comes to mind. And one of the ways to reduce stigma is, showing folks living with HIV, talking openly about HIV, and also just sharing the basic facts about how HIV is and is not transmitted. So let's take a look at one of those.
There's a lot of misconceptions about how HIV is and is not contracted. People think drinking out of a cup, hugging someone, sweat, tears. It is really important going back to the basics and saying, this isn't how you get it.
I hear all the time, what's the biggest barrier to ending the HIV epidemic? Stigma, 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 right? But where is stigma reduction in our integrated plans and in our responses that we're doing things to chip away at that? And now I said we're going to talk about respond to. So we've hit the other three pillars. When we're talking about cluster detection, surveillance, the work of disease intervention specialists, all of the pieces for the other three pillars could be utilized to respond to a cluster. So we've helped some health departments do exactly that. So all the messages that I've just showed you and many, many more that we don't have time to look at, we can choose selectively based on the demographics in that local cluster, based on the community, and use social media to place messages in a really focused, kind of amplified way as part of a cluster response, not to take away from partner notification and all the other pieces, but you can layer in small rural population areas, sort of laying in using social media to reach folks, or in larger jurisdictions as well. And of course, we take a syndemic approach, especially in the sense of other health issues, as well as equity issues. You've already seen that our messaging highlights people of color and LGBTQ folks. We also address intersecting issues like homelessness, mental health, substance use, and other diseases. So let's take a look at some examples of other topics. The next slide, we have MPOX, especially related to vaccines and encouraging the second dose. I know a lot of you have a bunch of vaccines to mobilize before the end of October, so these are designed to help do that and beyond, along with other STDs. Not shown here, but we also have Hep C testing banners as well, and content specific to syphilis, given the situation we're in with the case numbers now, and DoxyPep, which can help us with that. So let's look at some examples of how health departments and CBOs are using these on their social media. So in the center, you can see this is a Facebook post from an organization in Texas called the Help Center. It's coming from their account. So that little tiny thing at the top is their own profile picture at the top. Notice how they've also added their logo and their locations, but that profile picture does the job too. And then their phone number is in the text below, so folks can take the next step and know where to reach out. Mississippi used a different graphic and without adding a logo to the image. See how it's still co-branded. This is the easiest thing in the world. You take one of our images or videos and put it on your account. It is co-branded because it's coming from you. It has your profile picture on it. So whether that's a logo or your program that you're serving under, it's all right there. So when I mean that I say greater than is all of ours, same with Atlanta, they used one of the videos, but there's an example of their HIV specific account. That's not the Board of Health of Fulton County. It's the Atlanta sort of HIV response. You can see how the content and audience can be more focused, and also how you can leverage these pieces and present them from you, which we love because folks trust you. You are their local resource, and that's exactly why we make all of this. So a couple more examples. Here's some STD graphics posted by New Jersey, Arizona, Jefferson County, Mississippi. You can see Arizona, well, maybe you can't, it's super tiny, but Arizona included a learn more link that goes into their website. So again, it's a great way to connect people to the time and effort you put into building out resources on your web pages, or if your web page is not up to what you want it to be, you can send folks to anywhere, right? Go find more information. You're welcome to link to us or to hiv.gov or wherever is a good service directory or appointment scheduler. I think it's really about shortening the distance, meaning taking down as many barriers as possible to connect people to services. So clear information and where to go, get what you're talking about on social media. Let's just take a couple more examples. This is DoxyPep, some of our newest banners reflecting finally the guidance that CDC has put out on DoxyPep to prevent chlamydia, gonorrhea, and syphilis. We're introducing the idea. It's still new to a lot of people, so explaining what it is. And you can see here, because the social media profiles have the organization's name and logo on them, everything presents like it came directly from that organization. So all of these pieces together, I've seen lots of different messages. You can think of them collectively as syndemic messaging. We can go on to the next slide. I think we have a quote from Dimitri from another social media platform. I think this is from X, formerly known as Twitter, emphasizing that HIV doesn't occur in a vacuum. So we know that all these topics intersect, and also that there's only short amounts of time that we have on social media. So we can do sort of one at a time and collectively make them syndemic, or we can combine them into messages together where it's HIV and STI testing, where it's a sexual health checklist of all the different pieces. And I know everybody's working hard to braid funding and find other ways to deconstruct silos between HIV and STI teams, between prevention and care teams, our insufficiently funded hepatitis and harm reduction teams. In addition to everything else I've shown you, we've been working with CDC for the past year and a half to produce more syndemic messaging. So complementing those, this is a series of more than 100 videos that feature health experts talking about all the facets of sexual health. I told you over 100 videos. There's a lot of content. Testing, PrEP, treatment, congenital syphilis, 3-site swabbing. Leandro is bilingual, so we also have a lot of that in Spanish as well. And there are piles of messages for regular folks, for our consumers, our clients, as well as messages for providers. So if you're in an area, and I think it's almost everywhere in the country, where we need more primary care folks to recognize how easy it is to prescribe PrEP and to not stigmatize about sexual health conversations, to invite sexual health histories, do a better job at taking sort of culturally appropriate sexual health histories, screen more often for STIs. There's a series that is peer-to-peer, provider to provider on those topics as well. So messages for consumers, sort of everyday folks, on all the different facets of HIV, STDs, other sexual health topics, and then also pieces for providers. All of it has been co-branded with CDC. It has been fully vetted. So these are part of what we have available for you to use too. So I'm going to show you just one example. This is like choosing your favorite child, but let's look at one. This is Dr. Charlene Flash, who runs an FQHC in Houston and has years of experience caring for people living with HIV.
I'm Dr. Flash, and I'm here to talk to you about HIV. I have the privilege of taking care of people living with HIV. Some are people with new diagnoses that walk in and they're scared. And so I feel that part of my ministry for them is giving them their power back. Some people blame themselves. If only I had done this or not done this. That doesn't take your power. You still have the opportunity to reshape that narrative. There's nothing that's a foregone conclusion that I can't have a relationship, I can't have a baby, I can't be loved by my family, I can't fully disclose who I am and all the elements of myself. I want you to know that all of those things are possible.
So you can see how that's co-branded. And now I'm going to tell you where you can find all of these things. So this is greaterthan.org/materials. And I just dropped the URL, the webpage link in the chat function. So you can copy and paste, go ahead and pull it up if you're sitting at a computer and you want to take a look around. It's even better in real life, the interactive version. But you can see there's this filter so that we've sorted the content so you can look by topic. There's HIV and STI testing, PrEP. All the doctors that I just showed are in the Ask Me Anything section. So if you want those messages, you can find those. There are messages for awareness days, and there's also a little box to tick if you want to filter for Spanish content specifically. So there's a ton here. It is a lot. And if you ever need help finding anything, please just reach out. We know our content pretty well, and we'll be glad to, I've memorized half of that. We'll be glad to help you find what fits you best. So when you choose one of those filters and click, this is what you'll see. So this would be an example if you were clicking on the STD messages, you want STD testing, you'd get a mix of messages and you can see the different sizes. I know there's a lot of details here and the folks who are doing the posting will appreciate this. So just to kind of translate the Greek a little bit, where it says 16:9s, those are the horizontal sizes. So things that would show up on a computer screen or a TV screen. A lot of YouTube is in that size. And then the 9/16s are the vertical ones. So when you see something on Facebook or Instagram or TikTok, those are those longer vertical forms. So they're just referring to the dimensions of the pieces there. And there's also links here to the YouTube videos. So you can either download the full message, which is what you would want to use if you're going to put your own post onto Instagram or Facebook or something like that. But if you're embedding them in a web page or just want to show them at an event or in a training or wherever, you can use the YouTube link just to click over to YouTube. There's also our YouTube channel, which I'll show you in a second, is at Greater Than HIV, where you can look through playlists and go video hunting, have a little watch party, and follow your own adventure there. So I think that is my time. My next slide is information about how to stay connected. So you have that website, greaterthan.org. /materials if you want to find that library. You can also follow us on social media. So I mentioned YouTube as well as Instagram, Facebook, we're on X. I'm at Greater Than HIV. And you can always reach out to us and I will get messages at greaterthan@kff.org. My lovely colleagues Valerie and Emily are also on this call, and there's a team of us that would be glad to work with you. In addition, if you're interested in joining the National HIV Testing Day activation, you can scan this QR code or check the chat, and I put the link in there to sign up. Just let us know that you're interested, and then as we get later in the year and into 2025, we'll send out next steps and kind of making sure either testing on site or being a partner with us and helping to amplify, because you may be a health department that has resources to bring attention or make sure we've got the latest contact information with your funded partners, all of those things. So I am now going to thank you very much for your attention and for carving out some time today to find new ideas. I hope you found something here useful. I would love I think we have a chance now for questions and discussion. If you want to come off mute and either ask a question or share how you're envisioning using any of the resources we shared today to help enhance your community engagement, we would love to hear from you and welcome your questions too.
Thank you, Robin. Yes, so as Robin shared, please feel free to drop questions in the chat, come off mute. I'm also dropping an evaluation for the webinar. So we'll also be sending this out with the recording and the slides for everyone. But as we said, we'd love to hear what questions you have, or thoughts or feedback, what's worked for you, or things that you've done. So we open the floor now.
I know somebody's sitting there thinking.
I have a question.
Hi, Monica.
You were talking about utilizing social media in order to target specific populations, demographics, etc. And I'm curious if you guys have, when determining who to target, there is obvious like use of like your statewide data on who's, our new diagnoses with HIV, etc. Like we can look at our epi data and things like that. I'm curious if you have any experience or recommendations on thinking through doing like a more robust community analysis to identify populations that we should be targeting for these campaigns.
I'm not sure I'm following what you mean by more robust. I can maybe speak to generally when we're focusing on specific audiences, we're asking the health departments to direct us, and sometimes we'll review, epi and surveillance and take a look. It can be tricky because there's, lots of folks that need messaging and different types of messages, right? So, do we assume at this point that most gay and bisexual men know about PrEP? Maybe more so than cisgender women, for example. Like just different thinking about slicing them in ways and then serving messages that are appropriate to each audience if you have the opportunity to do that. One thing I talk a lot about with some of our partners is what the right budget is for those. Like if you do have resources and you're trying to reach 13 million people versus 13,000 people, kind of what's possible and how many pieces of that pie you can slice without it getting so thin that like nobody gets enough. Can you clarify a little bit more when you say a broader, deeper analysis?
So we have, I know that we have state epi data on like demographics around who has been diagnosed with HIV in Alaska over the last handful of years. What we believe is that we have low testing rates to begin with, and that there's a lot, and there was a CDC assessment that kind of reflected that as well, that a lot of people are just generally not aware of PrEP or getting tested. And so I think that so we've seen if for some of our STIs, and I haven't looked at the data recently, but we know for syphilis, we're seeing an increase in people experiencing homelessness. And we're seeing a lot of syphilis in that specific population. If we don't think people are getting tested for HIV and therefore we're missing diagnoses, the picture that we have painted around who is at greatest risk may not be accurate because people just aren't getting tested to gather the demographics on who has it, if that makes sense.
Absolutely.
And so trying to think through who are the people who are unengaged with healthcare systems broadly and trying to target those populations. Just trying to think of ways to gather more information than what we have because we think what we have is limited.
Yes. Thank you for clarifying. That's really helpful. I think an important question, Monica. We have certainly used STI rates to inform where we should be placing HIV messaging. Or sometimes we'll combine it all. Maybe it's a little lower barrier. There's less stigma around STI, STD testing generally. So, but of course, HIV can be part of that. So kind of figuring out the message that's going to be appropriate. Also looking geographically. So, where are you seeing your cases, other demographics in terms of age and where specifically you think you may be missing, or looking at other social determinants of health on, socioeconomic status or, different communities that you maybe want to narrow it down. And that's the beauty of, I should be clear, you kind of need the budget to be able to pull those specific levers unless you're working with partners who already have those followings on their social media accounts to reach specific communities. But when you have some budget to put behind it, you can do those specific pieces. So, you know, not to say that if it's, you know, if you're seeing cases mostly among folks under 30, that it might not be their grandma or auntie who's going to direct them into testing, right? Not to say there's not value in that, but if you have limited resources, you might want to focus on a particular age group or gender, and definitely looking at those other pieces of information, sort of where and among whom do you think that you're missing to direct those. Thank you for the question, Monica. I want to read off a couple of questions in the chat. Alexa was asking if we post any of the resources, do you want us to tag the greater than account? We would love that. And a lot of times we're able then to help amplify too. So, you know, to reshare on our stories or on X. So that's all at greater than HIV. And there's another question, if we use a video graphic on a web page, should we hyperlink or credit greater than website? You're welcome to, if that's helpful to you. We exist to lift all ships, so it's definitely not necessary. If you have your own kind of local, if there's a better resource, link to that. If you want to link, you know, for more information or for additional videos like that, you are welcome to link into our playlist or over to our website, to use our directories, any of those things. So generally, we're not looking for credit, we're looking for healthier people. But in the cases where sort of tagging us or mentioning might help folks get to more resources, we invite and welcome that too. The only thing we ask, and there's some like language on the materials page, is that you don't change any of those assets, the graphics and videos, without our written approval. Mostly because everybody in the campaign has approved those messages with their, I mean, we're talking about real people with real voices, right? So we don't want to do that. Also, we can often help localize and get you, you know, sort of the exact asset that you need. So we can have a conversation if you're interested in making any changes, or if there's something that doesn't work for you, we want to know that, and that can help us improve too. So thank you for the questions about credit. Please use them broadly and widely. You're very welcome, Alexa. Did anybody else have any questions? Ideas like, oh, I hadn't thought about it until today. What are you going to do? Be brave. I'll remind you, if you're talking, you're muted, so you have to unmute yourself. But also, we could give you 3 minutes back in your day.
Well, if there are no other questions, as Robin said, we can give you a few minutes back to your day. But we do encourage you to take a look at the slides when they do come out. Reach back out if you have any questions, or if you just want to talk through anything. As Robin said, they are here. I think you said to lift all ships, which I liked. Thank you. But as well as reach out to NASA, we're happy to connect you. We're happy to support you in your work, in your journey through social media and through community engagement. So please, 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 please don't ever hesitate to make that connection. We thank you all for your participation. Again, please fill out the evaluation link that was sent in the chat. It will also be going out with the recording and the slides. Share your thoughts on what was shared today, and we look forward to seeing you all again sometime in the future. Have a great day, everyone.
Thank you, everyone.